Heat stroke in dogs. So what is heat stroke? Heat stroke is a form of hypothermia. This occurs when an animal cannot expel excess heat when exposed in a hot environment. This causes the core temperature to increase to dangerous levels. Some dogs are more susceptible to heat stroke, such as dogs with thick fur, huskies, dogs with short flat faces, pugs or bulldogs, or overweight dogs. Dogs' temperatures should be between 38 to 39.2 degrees Celsius, as it is dangerous for a dog to exceed 39.5 degrees Celsius in temperature. Signs and symptoms of heat stroke. Heat stroke is not an immediate symptom but can be shown through heavy panting and restlessness. It can then progress to weakness and collapsing, followed by vomiting and diarrhea. Dog can become unresponsive or dull. In late stages, seizures can develop, and if heat stroke is untreated, then shock can develop as well. Causes. Heat stroke is caused by external factors such as hot environment to overexertion and heat. This can include hot days, warm enclosed spaces, being left in the car with no ventilation. Treatment. If your dog is suspected of heat stroke or showed signs, then the dog should be moved to a cooler environment. Cool water should be available to the dog, not cold, as cold water can cool the dog down too quickly and cause shock. Having a wet towel can help cool the dog down. If your dog does have heat stroke, you should contact your local veterinary practice. Here the veterinary surgeon can assess the dog for complications and help with moderate the temperature. Veterinary treatment. Within a veterinary practice, emergency cooling can be done, especially if your pet's temperature is high. Intravasive fluids or IV can help treat dehydration shock and cool the body down internally. The dog may need oxygen therapy. Anesthesia and airway incubation for pets that are having difficulty breathing or are unconscious due to heat stroke. Gastric prophylactics and anti-nausea medication in case of vomiting and diarrhea, as the gut may slough and start to die. So you also have antibiotics to prevent a secondary sepsis, which is blood poisoning. Dog may also be given pain relief. Cardiac medication may be required. And then they may do blood tests to assess the severity of the dehydration, test for clotting and assess the blood function, as well as monitor the response of the treatment. Ongoing monitoring treatment is usually done within the intensive care unit. Recovery. Dogs that have moderate heat stroke can often recover with no health complications. However, hypothermia can cause organ damage, which may need ongoing care and treatment. It has been shown that dogs who has heat stroke does increase their chances of it happening again. Prevention of heat stroke. In order to prevent heat stroke in the future, it is best to keep your dog that have any predisposing conditions such as heart disease, old age, obesity or breathing problems cool and in the shade. Always provide access to cool water. Do not leave your dog in a parked car, even for a short period of time, as temperature can reach up to 60 degrees. Make sure at all times your dog has access to the shade. On hot days, restrict your dog's exercise, and on hot days as well, avoid areas of concrete or asphalt, as heat reflects off the ground and there is limited access to shade. And other methods can be by wetting your dog or allowing them to swim. This can help regulate your dog's temperature. And that is the end of the video. I hope you enjoyed it, and for any further reading, all references can be found on this page.